Hi, my name is Dr. Arthur Greene. Welcome to Homestead Animal Hospital. We have a unique piece of equipment here. It's a hyperbaric oxygen chamber, just like the types that's used for decompression for divers that have problems. However, we use it on animals, and it really helps cure and resolve many medical problems that we'll see in animals. It's a interesting device. It looks much like a submarine, as you'll see, but its function is extremely medical. And we've had it about a year now, and we're seeing wonderful responses with many of our animals that are in need of treatments. We can get the information in the computer, and you'll see that. I'll have my assistant Zach to give us a hand, and we'll show you that we're actually using it on a bird today who has a wound that's not healing. So welcome aboard, and come see our chamber. Thanks. This is Zachary, our technician, and right now he's in putting the information for our particular case. Every case is different and has a different indication and various pressures that the animal will go down below water, actually, in essence, so that the oxygen is going in at a certain rate and a certain pressure so that it gets into the animal's blood and plasma, where it will then reach the tissue of interest that's injured and help resolve the problem. Right now he's putting it in for a bird that has a wound, and so this is a wound care case. This is a feather picking bird, so he's probably injured himself accidentally. The case was referred to us by an avian specialist in town, and who has been working on trying to resolve his wound as well. Our little buddy will be in the chamber for a total of an hour and a half, from descent, which takes a slow time of 15 minutes, to reaching the pressure where he'll be, and then coming up very slowly, much like they do in people in these chambers, so that the pressure is equalized internally and doesn't cause any secondary problems as it may. So we're just about ready to get our birdie in the chamber, whose name is Hank. Thank you, Hank. Okay, right now Zach is placing Hank inside the hyperbaric chamber. This chamber can actually hold an animal as big as 180 pounds. Hank certainly is nowhere near that. As we're doing this, we're going to tighten this up so that it's airtight. And then we will turn on our valve so that oxygen flows in and it removes the ambient air that is inside the chamber, to the point where there will be 100% pure oxygen within the chamber. You may hear some oxygen tanks or generators kick in. We generate the oxygen that goes into the chamber. We'll eventually monitor that with our gauges, which will tell us at what atmosphere we are, and that'll also tell us that pure oxygen is getting into the chamber. We go around here in a predictable way so that we know that each clamp gets tightened in a manner where we can trust it. Hank should not feel anything. Most patients that are in here usually just relax after about 5 minutes. Some become a little restless, some hyperventilate, but normally they'll sit down and just pretend as if they're in their own kennel or a cage that they may have been in at home. And they usually adjust well. We haven't had any animals that get really very upset. And when you have the pure oxygen come in, it usually makes them feel pretty good. Just like a person who was on an oxygen line, if they have respiratory problems, obviously you feel a lot better and your body feels great when it's oversaturated in the blood with oxygen. And now we're going to turn the chamber on. Okay, Zach? Alright, as you can see, there's a video camera inside here. There will actually be 3 images. You can see little Hank up here. And we're going to turn on our valves to start engaging the oxygen to flow into the chamber. And then we're going to monitor our different gauges here to give us an indication of how we're progressing. And the time frame will be indicated as well. Okay, Zach, why don't you start that? Go ahead. All right. Once you get to a different level, the oxygen starts flowing in, and we're going to monitor all these valves. And this is an outflow valve where the oxygen, actually the ambient air in the chamber is actually going to leave the chamber. And once this starts getting enough pressure inside, this valve will go up to a higher degree, and then we'll gauge that as well. This is the initial pressure coming into the chamber. And now it's a wait for about 15 minutes time frame, and we monitor our little patient, Hank, and anyone else who would be in there as well. As you can see, Hank is now in the hyperbaric chamber. He's been in there approximately 15 minutes. He's resting comfortably. We've reached our target time of 15 minutes and have increased the pressure over that time frame gradually, so shows no complications and no harm to Hank. At this point, he's in the chamber time for an hour at the standard pressure, and we'll be monitoring him as he goes along. He's done well on previous occasions, so we expect that he'll be doing fine at this time as well. At this point, Hank is in the chamber resting comfortably. He's been at pressure for some time now and will be observed for the balance of his chamber procedure, which lasts about an hour. Zach will be monitoring him through that entire time. He has been trained by specialists in this procedures, as I have, and we want to make sure that Hank does well. Hank should be coming out at that point, and we expect to see him happy and chirping and trying to bite us again. Thanks for enjoying this video, and we hope to see you come down here someday if you need to for your sick pets.